Hello, I'm Gabrielle. This is my video for gender-based medicine. My target audience for this video would be healthcare professionals or people who are in contact with patients. This video will discuss the differences between sex and gender, gender affirmation, gender-based medicine, and challenges in healthcare with gender. So starting off, sex is your biological attributes. It's what you're born as. Are you XX female, XY male for chromosomes? It's your physical appearance, facial hair, no facial hair. What do you look like? Are you looking female, looking male? And hormone levels, high testosterone for males, higher estrogen for females. Both male and female have testosterone and estrogen. It's the different levels which are associated with the chromosomes that make the difference. Gender is your socially constructed role. So boy, girl, man, woman, what you identify as. It's how people perceive themselves. So your sex could be female, however you identify as male, and that is your gender. Cisgender, binary, non-binary, all those terms encompass gender. This is important when working in a hospital because you may encounter patients who have a different gender identity than their biological sex. So there are trans or gender diverse patients that you may encounter. These patients are important to be aware of because those populations suffer from higher violence, discrimination, and transphobia than your cisgender patients. So that's important to know, as it can help when treating these patients. Some statistics about trans and gender diverse patients are that 63.7% of that population suffer from depression, 74.6% have anxiety, and approximately 48.1% of that population of trans or gender diverse people have committed suicide or attempted. These numbers are really high. There is a lot of social stigma and mental challenges that these people have to overcome daily. So it's important when treating them as patients to be aware of that and try to treat them the way you would want to be treated. That's important because it's important to practice gender affirming health, which is tending to someone's physical, mental, and social needs while respectfully affirming their gender identity. This is important in a hospital because it creates a gender neutral and safe environment that focuses on a patient's treatment and health. This can lead into gender-based medicine, which is improving treatment for both men and women. It's medicine that focuses on drug differences in metabolism and differences in treatments for men and women. One example of this could be a drug that I had actually taken as a teenager called Accutane. I took it for acne and it worked, but it wasn't the best. I still kind of actually have acne now that I'm older. They're finding now that this drug works better in males, so they really don't even prescribe it in females as often anymore. So things like that are important to learn. It can change the way we treat patients and treat people as a whole. Some other things that I learned about gender-based medicine are that women don't respond as well to vascular treatments as men. Something I learned was that women who underwent coronary bypass had earlier mortality rates than men. And there are new risks and approaches and interventions that we're finding out daily based on treatments for men and women. There are also like metabolism differences, exercise differences. All of these are now coming into patients' treatment, which is important. I hope this video was informative and helpful. I know I learned a lot, and thank you so much. See you later.